I guess we're ready to get started. Nobody wants to sit down. I mean, pull up. There's limited seating, I see, and it looks like they're 6 feet apart. I'm not really 100% sure. So, Madam Lieutenant Governor, you should probably join us up front. Yeah, it looks like you're on this agenda appropriately so. So thank you for joining us. This is really an important bill that I'm going to sign today, and I'm going to leave most of the explanations over to the sponsors who've done really tremendous work on the bill. And as I think about the things, particularly in healthcare, that we focus on, there's not much that's more important than this, right? Is trying to get more of our healthcare service delivery, up front, primary care physicians, and that's what this bill is all about. I think in reality it's going to be difficult to do. I know our insurance commissioner is going to have a big role in that, and we appreciate him being here. But before we get into the bill, I just want to take this opportunity to thank our physicians and our healthcare providers for the tremendous work that they've been doing over the last year and a half. It's just, I tend, as we all do, I think, we tend to generalize from our own provider, and I think about my primary care physician and what he's been through and how he's helped me, and I need his help more than ever, by the way. I find that I'm using healthcare services more than I did when I was younger. But just at a time of such great uncertainty, how much trust we put in our physicians. And particularly now, as we're the biggest challenge that we have is to get everybody vaccinated, right? I think the hesitancy among some significant percentage of our population is there, and I think those who are best positioned to help us get through that hesitancy are our primary care physicians and physicians generally. So I can't thank you enough for what you've done over the last year and a half and under very challenging circumstances, and your help going forward, because we're not done yet, particularly on the vaccination side, and we need your help doing that. I mentioned this is one of the more important issues in healthcare, and one of the more important public policy issues that we'll deal with. It's also really complicated. I know that in part because I was going to say the privilege, I'm not sure it was a privilege, to serve on the Healthcare Commission, guys like Dr. Jim Gill, and we've known each other for about 15 years now, and you've been an incredible advocate with a lot of others I know with the Medical Society around just how do you push more healthcare spend, up front. And I want to thank and congratulate two of our real leaders in the General Assembly, Senator Brian Townsend and Representative Vance. I'm going to save my compliments for Senator Townsend since he's staying around, and use the time I have to compliment anybody for Representative Vance. This guy, he's announced he's retiring, semi-retiring from public office. I just can't tell you what a great person he has been to work with. Just incredibly smart and measured and responsible and easy to work with, and I'm sure that you have seen that yourselves. It's been a treat for me to work with him directly. I know he works a lot more with Secretary McGarrick and others, but he's just been an incredible partner in the legislature, and we're going to miss him. Senator Townsend's a great leader too, but he's going to stay, so I'm not going to say really a lot. But with that, I will first compliment and thank Senator Townsend for his work on this and his leadership. It wasn't just a one-year thing, and I remember receiving a text from him earlier this year, and it said something like, do you think you're going to be able to support us on this piece of legislation? And he knows that I know too much about this to know that it's complicated and difficult, but I couldn't but anything but supportive, given how much work he put into it, how much work all of you put into it, and how important it is that we get this right. So, Senator Townsend, please come forward and talk about your piece of legislation.
Thank you, Governor. Thank you, everyone, for being here. I'll be very brief with the description of the legislation and hopefully somewhat brief with the thank yous to so many whose work was essential to having this become a reality. First, Senate Substitute 1 for SB 120 simply makes it clear the priority in Delaware is to keep people healthy in a healthcare system, and the way to do that is to invest more in primary care. Keep people healthy on the front end rather than just waiting for people to be unhealthy on the back end. And that doesn't happen, I don't know anywhere in the country where it just happens magically. Particularly in a state like Delaware. We're small, we have high concentration in the insurance industry, we have high concentration in the hospital sector, and there's some upsides to that, but one of the challenges from that is that we don't necessarily have some of the forces working towards primary care in the way that we need to. And after several years of efforts, now we have a bill that will push us in that direction. We will need to continue to tend to this. The way that's set up, it involves a very much important process now that the Insurance Commissioner's Office and the Department of Insurance will have to pick up and run with. We'll continue to be involved in all of that, and there's a sunset that was put on as part of the inevitable legislative process. We'll have to come back and revisit this and make sure that it's working. And I fully intend to be supportive of that and to make clear that bill sponsors are happy to tweak when it will make improvements, but we're not going to retreat from the value statement that this piece of legislation represents. I'll try to be very brief now in thanking those without whose support we wouldn't be here today, and in no particular order. Dr. Nancy Phan is an absolute treasure to the Delaware medical community and all of Delaware. An unsung hero whose work on the Healthcare Commission as a provider as well as a huge reason why we are here, and it was an honor to be a co-chair along with her and Representative David Bentz on this. Representative David Bentz, on a personal and a professional level, it's extremely sad that he will not be seeking re-election. He is, I think, one of the best legislators there ever will be in Delaware. His commitment to policy and integrity and decency and usually patience, although I think I've rubbed off on him a little bit. He's not always the most patient anymore. I'm sorry about that. But it's a true loss to Delaware, but that's the nature of it, and he served so well and so honorably for a few short years, but with such a tremendous impact, particularly in the area of health care. Senators Sarah McBride and Dave Sokola are here. Senator McBride is the new chair of the Health Committee. Senator Dave Sokola is the president pro tem. If they, in their own ways, had not been so supportive of this legislation the past few months, it might not have gotten done. It might not have come out of the Senate with as strong a statement as it did, and therefore might not have made it through the House, notwithstanding Representative Bentz's uncanny ability to work magic with legislation. Governor John Carney, he referenced the text message. If he had not been willing to stand up for this legislation, if he had not been willing to look key stakeholders in the eye and say, we have got to do better by our health care system, we have got to invest more in primary care, it probably would not have gotten done. He might not have been able to do that as much if his health secretary, Secretary Molly McGarrick, was not such a tremendous person, leader, policy guru, and her team of people, and I'm sure maybe she'll speak to them, but just DHSS was such a key partner throughout all of this in making sure that we have got to keep Delawareans healthier on the front end. Commissioner Trinidad Navarro and his team, and Chris Haas, I believe, is here, and others in his staff, if they hadn't stepped up at a certain point in time where they, for very good reasons, kind of had the football, so to speak, and made very clear the detailed analysis they put together, showing examples of systems and showing examples of how bad the problem was and showing examples of how we can achieve progress, it might not have happened. I might be forgetting people beyond that. Christiana Care was extremely helpful in ultimately supporting it, and Dr. Nevin and her entire team, Meredith Tweedy in particular, were very, very committed to trying to get this right, and it certainly involved compromise with them, but that is a laudable thing, which wasn't certainly a hallmark of other key stakeholders in the health system ultimately. So I want to thank Christiana Care. So we have more to do, and I'll say medical society as well. Governor Carney talked about the physicians and providers here. It's always inspirational to see you in your provider coats. And without your tenacity, and Dr. Gill and others, without your tenacity, we probably wouldn't be here either. So medical society and Mark, thank you so much. It truly was such a team effort from all those other individuals, and I'm sure others whom I've forgotten. I apologize, but we have done more than plant a seed here for trying to get Delaware's healthcare system to be one that we can be so proud of, for trying to keep people healthy from the get-go. There inevitably will be accidents and injuries and acute injuries. There inevitably will be a need for specialists, but we as a state, and certainly we as a country, have got to do a far better job of keeping our people healthy. It so happens to come at a lower financial cost if we do that. There's a huge benefit to it. But there's also a moral obligation, I believe. It's a very complicated system. Governor Carney referenced that. I myself, and frankly many people here I'm sure, but I'll admit to it too, I don't do everything I could do to keep myself as healthy as possible. There are ways that government policies and government funding can keep us healthier, help promote our health for lower cost on the front end. That is the way the system should be. This legislation will help us get there. It has been a long road, but thankfully we're here, and there's more to do. Commissioner Navarro, looking forward to pushing with you on that part of it. And just want to thank everyone for their endless support of this issue over the past several years. It's so wonderful to be here today, to have the governor sign it, and to continue working on this effort so that Delaware can be the healthcare system that we truly can be proud of overall. Thank you, everyone. Is Representative David Benz next? Because is this the roast? Can we do roast here while we're here? No, you're about to hear from someone who just is a tremendous public servant, and I couldn't possibly speak highly enough of him, Representative David Benz.
Good afternoon, everyone. I appreciate everybody being a little too nice. You're making me a little uncomfortable. But, you know, you could still, I guess, change my mind if you're going to keep being this nice. But we'll see. So that's a joke, everybody. Is there nobody write that down and print that somewhere? So this I like to kind of go back to when I'm at these things, go back to kind of the genesis of legislation. This one is a particularly long story to go from how we got started on this to where we are now. This is an effort that spans several years. I think it's, what, 3-4 years? I'm kind of losing track because one of those was a COVID year, and there's count for like 10, I think. But we started this with this vision of, you know, primary care was struggling. Practices were struggling. Access to it was declining. And all that was happening at a time when healthcare costs were growing. Despite the fact that primary care is that access point, that best value for every dollar spent in healthcare, and that's where we should be focusing a lot of our dollars. And as Senator Townsend said, so much of it, so much of the money, so much of our investment was going on that back end in the hospital settings. Once situations had grown beyond something that primary care could really treat. So how do we look at that? How do we try to address that? How do we make sure that the healthcare dollars we are spent are being put to the best use, both for value, financial value, economic value, but then also for public health value? And that's in investing in primary care, keeping people healthy, keeping Delawareans healthy. And this piece of legislation is not the first thing we did along the lines to try to address that, but it is by far the most significant thing we've done in the 4 years since the Primary Care Collaborative has been meeting. And it's always a real proud thing to see that much work from that many people result in something significant. Too often we see these efforts go on and kind of fizzle out or result in sort of half measures and things like that. But this is a case where we kept pushing despite some confrontation, despite some conflict, despite not always agreeing. And we said, you know, we're just going to keep meeting. We're going to keep hashing this thing out, and we're going to get to something that we can deliver for the people of Delaware. And that's what we're ultimately able to do. And again, it doesn't happen without, you know, other people that Senator Townsend recognized. I'm not going to repeat them all because I'll probably leave one out. I will just acknowledge the one person I will acknowledge is Dr. Nancy Phan. Again, she was right there along the way, every step of the way, meeting over and over again, discussing this with Senator Townsend and I, and leading the Primary Care Collaborative. I thought working with the Health Care Commission was delightful. Yeah. We'll see. Dr. Phan, we really wouldn't, that sort of clinical expertise you're able to provide to the business of running a small practice and you know, being on that ground level was so valuable to somebody like Senator Townsend and I, who have not been medical professionals before in our life, and we really wouldn't have been able to come to such a good spot here with this legislation without your leadership right there with us. So thank you for all of that. And again, I wouldn't just say thank you to all my colleagues, and this doesn't represent an end point. This kind of launches us into a new starting point here as the work's going to continue through the Office of Value-Based Healthcare under the Insurance Commissioner's leadership and continue work with DHSS and the Governor and the Legislature. So I look forward to continuing that work at least until November of 2022. And thank you, everybody. And I guess my job is to introduce now our fearless Secretary of the Department of Health and Social Services and a great leader on this issue, Secretary Molly McGarrick.
Hi, everyone. Good afternoon. So I'm going to try to cut down remarks and not repeat what people said before, but I do think I do need to repeat the work of the Primary Care Collaborative, especially co-chair and our Healthcare Commission Chair, Dr. Fan, who is amazing and a fearless champion. And also have others from the Medical Society here, Dr. Taylor, Dr. Burdett, others who, Dr. Gill, who have been alongside us this entire pandemic, before the pandemic, and we would not be where we are today without your leadership. And it really is appropriate that we're gathered here at the Medical Society today, because when we're talking about primary care, it really is the most trusted relationship in the healthcare system. From the patient's trust of their pediatrician to them being older and potentially having to manage multiple chronic conditions, it is the primary care clinician, by their experience, training, and their empathy and compassion, that really validates and creates a profound relationship that keeps patients healthy. And so this legislation validates that relationship and invests in it so that it can continue into the future. And with ever-increasing healthcare costs in our state, we know we need to move our healthcare delivery system away from services and volume and move to patient-centered outcomes and value-based care. And other states who are ahead of Delaware in that mission have primary care as the foundation of that work. And again, that's why this legislation is so critical. And so we need to do better, and with the governor's signature today, we will start doing better. When I worked for Beau Biden, and I know many of you have heard this famous Biden family saying over the years, don't tell me your priorities, show me your budget, and I will tell you your priorities. Prior to this legislation being signed and going into effect, we spend 4.5% of our healthcare dollars on primary care. And so this legislation really allows us to put our money where we say our priorities are and create a healthy foundation for Delawareans throughout their lifespan. So it is my honor to be here. Thank you to everyone. And as people have said, the work continues. We have lots more fun ideas. Sorry, Governor. And with that, it is my honor to turn it over to the Lieutenant Governor, who many of you know is a fearless and dogged champion for primary care, for public health, really for the health and safety of all Delawareans. Lieutenant Governor.
Thank you, Madam Secretary. Joy saying that. I really am delighted to be here. When I look to our Secretary and to our incredible sponsors of this legislation, and I know as our Governor's heart mentioned about the Healthcare Commission and our Secretary, today is another step, another tool in the toolkit for a stronger, healthier Delaware. And as I look to my colleagues, not only here at the Medical Society, but my friends in the advanced practice registered nurse world, where I just came from leading a dissertation this afternoon, it is really about coming together, providing entree for all families, all zip codes, to be comfortable in a place where they can provide both behavioral health and that physical health that is necessary. And I know to my incredible Senate colleagues, as well as the representatives and Representative Bombach, when we get you present along with our Secretary of Finance, we know it's about not only our health, but the economics of our community. And as our Secretary indicated, putting more funds in preventative health, where the community, the rubber hits the road, is the right direction and the right way to go. And the beauty of the Delaware way in our Senate and House, we learn through these models, and there's a lot more to do. I am sure we're going to tweak some things. I'm sure we're going to have changes, improvements. That's what matters. And at the end of the day, as our country's spending 18% on healthcare gross domestic product, let's make sure we're getting those outcomes. So I'm excited. I know we're on a tight timeline probably with the governor's schedule, so I won't say anything more, but just to say good job, wonderful opportunity while we begin this journey. And the final thing I'll say, thank you to my friends during this COVID battle. It has been tough. I know the burnout, I know the stress, and this is another way that we're going to make sure to provide the necessary support for the soldiers in the front line, our healthcare providers. So, Governor, I think I turn it back to you, sir.
Thank you, Madam Lieutenant Governor. Both Senator Townsend and Representative Bentz have mentioned that this is just the beginning, and it is. And the person in the agency responsible for a lot of the hard work going forward to determine what amount is being spent in different areas and to approve those insurance contracts is our insurance commissioner, and Trinity Navarro is here, and I'd ask him to come forward and tell him about how he's going to make this work. He's the guy who has to make it work.
Thank you, sir. Well, good afternoon. I guess I'm last. I just wanted to say thank you for your time. It really is a pleasure to be here. And I know that Dr. Fan has been recognized multiple times. You know, this endeavor is a success that's taken multiple years because Dr. Fan wouldn't let it fail. I will say that she stayed on us. She made sure that we stayed focused, and it's tough sometimes dealing with legislators and elected officials and the stakeholders here. So once again, kudos to Dr. Fan. So since the General Assembly created the Delaware Department of Insurance Office of Value-Based Healthcare Delivery, we've been working with our stakeholders for the last several years, and we really looked to create a roadmap aimed at increasing access to high-quality, affordable health care. We knew that primary care doctors were leaving the state of Delaware at an alarming rate. We knew that primary care doctors were moving to concierge service, and we knew that the best way to help people stay healthy is to make sure they're healthy, and that the importance of primary care, finding things, I know my colleagues already said this, but finding things and illnesses in folks that we can treat early on before they get to the ER is really, it's about spending money now and saving tremendously later on. So with the signing of this bill, those plans will be put into action. So just have a few lines here. This is a three-pronged approach outlined in this bill: increasing investment, creating cost containment mechanisms, and expanding alternative payment model adoption, which will ensure that the investments made in primary care and value do not result in unsustainable increases in total cost of care for our residents, and for me, most importantly, while not increasing insurance premiums. In the end, compromise and sacrifices had to be made by legislators, regulators, providers, hospitals, and insurers. As it so often does, progress requires a collaborative approach. So with this partnership and the involvement of our stakeholders, we're moving toward a healthier Delaware. Now, our office will be issuing a bulletin in the very near future with more information about this bill, as well as how individuals can comment on our regulations that will be forthcoming. That's it. So I'm going to turn this over to the governor. I just wanted to say that we look forward to implementing the challenges in this bill and providing for individuals for a healthier Delaware. Thank you so very much.
Thank you, Mr. Commissioner. We're going to ask anybody who wants to be in the photo. Nancy Fan has to be in the photo. You can't get recognized 5 times and not be part of the. Dr. Gill, I know, has got to be in. All the other members. Senator Townsend thanked everybody else profusely. He did not mention his own efforts, which were monumental, and I want to thank Senator Townsend again. And he also reminded me about my reaction after receiving his text message, which was to call Secretary McGarrick and ask her, where is she? Is she paying attention? To ask Secretary McGarrick how this fit into the efforts that we had in place since Dr. Odom Walker's tenure, where we were attempting to address the rising healthcare costs, and this became another mechanism for doing that. And let's just say, she said in her own way, if not now, when? If not this, what? We had a series of other ideas that we were looking at from the states of Vermont, Massachusetts, Maryland, but this was the one that was in the legislature moving through. So many people had bought into it. And so this is the vehicle that we're riding. Senator Townsend, Trini, Madam Secretary McGarrett, Madam Lieutenant Governor, Dr. Tan, and all the Fan, and all the rest of you. And so it's my privilege as governor to complete this stage. And I should also point out that Senator Sokola and Senator McBride are both co-sponsors of this bill and also here with us. It's my privilege to finish their great work. Senator Townsend, Representative Bentz, Senator Sokola, Senator McBride, Dr. Fan, and everybody else. Here you go, Trini.